Rajesh sir, please begin.
Okay, so a very good afternoon to all the viewers. Myself, Dr. Rajesh Singh, Associate Professor from Parul Institute of Law, Parul University. I warm welcome on this webinar platform, a virtual platform. First of all, the topic of this webinar is the human rights discrimination against the people with HIV. And today's our speaker, Mrs. Mahalakshmi Pavni ma'am, who is the Senior Advocate, Supreme Court of India. Let me introduce about ma'am on this virtual platform. First of all, I warm welcome ma'am. Mahalakshmi madam is the senior advocate and she is also the first lady from the Karnataka who is designated by the full court of the Honorable Supreme Court of India in 2015. She is the president of SCWA, Supreme Court Women's Lawyers Association, and she is also known as the woman who took the Nirbhaya case lawyers to the task. She advises on the diverse matters relating to the criminal law, constitutional law, commercial law, corporate law, and other general laws. So on this virtual platform, I warm welcome ma'am. We have second speaker, Ms. Pallavi Pratap. She is going to join 5 minutes later. Mrs. Pallavi Pratap madam is the managing partner at her firm, that is Pratap and Corporation, and was recently given a recognition of 40 under 40 lawyers by the Business World magazine across India. She has been practicing for over a decade now in the Supreme Court, High Court, tribunals, lower courts, and lots of ADR related matters. So I warm welcome on this platform. Just a minute. Sir, I want to stop this sharing. Then what I have to do? Stop share. Now, yes, sir. So I request Professor Debati Haldar ma'am to warm welcome our eminent speaker, Mrs. Mahalakshmi Pavni ma'am, who is a senior advocate at Supreme Court. Over to you, ma'am.
A very good afternoon to Madam Mahalakshmi Pavni ji. And also I know that Pallavi ma'am will be joining very shortly. On behalf of Parul Institute of Law, Parul University, I extend very warm welcome to you, madam. A very warm welcome to this platform. And today's topic, which has been very pertinently chosen by Dr. Rajesh Singh. We have gathered here to listen to you, madam, and also to know from you that what are the types of discriminations, what are the rights that are available to the HIV AIDS people. And I believe that your session here will also guide us to understand that it is not only about the HIV affected people or their family members who may be discriminated or who may have their rights against such discrimination, but we did get to see that in the lockdown period last year, and even this year also it is since going on, and with the new variant that has come up, we do get to see that there are people who are affected by pandemic, who are affected by endemic also, who are affected by terminal disease also, and how they are being discriminated at large, and how their families are also getting affected. So I will not take much time, madam. We are all eagerly waiting to hear you. A very warm welcome on behalf of our Dean sir, Professor Dr. Akil Sayed sir, and also on behalf of our entire faculty team. Very warm welcome, madam. Thank you.
Thank you, Professor Debrati Haldarji. Very good afternoon to you all. Dr. Akil Sayed, the Dean of Parul University. A good afternoon to Dr. Debrati Haldar, Dr. Rajesh Singh, the moderator and associate professor. Thank you for inviting me here. Good afternoon to all the viewers, students, and my co-speaker, Ms. Pallavi Pratap, advocate on record. Good to see you here with me. And today's topic is discrimination against people with HIV, AIDS, and their rights. Well, today is the 1st of December, and worldwide it's known as World AIDS Day. So it was founded in 1988, and it was the first ever global health day. And it was actually a day dedicated to commemorate to those who have died from this deadly disease, and an opportunity for people worldwide to unite in the fight against HIV and AIDS, and to show support for people living with HIV. So on this special day, World AIDS Day, I've been asked to speak against the discrimination and their rights of those people who have been discriminated. See, actually, HIV and AIDS is one of the biggest challenges faced by India. There are about 3 million people suffering from AIDS and HIV. The socio-economic condition of this country, coupled with all this traditional outlook and myths associated with things, has made it even more vulnerable to the disease. And the poor literacy level is one of the biggest causes for the spread of this disease. And this disease has a very serious social stigma attached to it. People with infected with HIV and AIDS are looked down upon in society. And the major field where they feel the effects of this disease are the workplace. The disease is not completely curable, but yes, to a great extent, the life expectancy has been raised. In 1980s and the 90s, it was a dreaded crisis, when this disease was had come on surfaced, and that time the life expectancy was not at all there. It was very, very bad, and resulted in fatalities at the most. But now, with the evolvement of the medical field and so much of progress in the medical line, and the cure is not there, permanent cure is not there, but yes, to a certain extent, the lifespan and the living conditions have improved. So it now has become literally undetectable, and people can live with dignity and thing, but it all depends on the stigma attached to it. So long as the stigma remains, I don't think these people will ever be able to live with dignity, or unless society changes its mindsets towards these kind of people. And the scourge of AIDS cannot be pigeonholed by citing that socio-economic conditions, apart from the trite lack of literacy and the unhygienic living conditions alone. There is a deeper crisis, and that has been slowly developing. That is a disproportionate healthcare system, and that is compounded by the lack of willingness to invest more in medical technology, with an aim to reduce the disparity between the haves and have-nots. In fact, we all witnessed this COVID-19, and it was a devastating pandemic which took away many lives. So this has literally been an eye-opener for the government, the authorities, the medical health care professionals, and the people in power, to re-examine the macro policies concerning the healthcare infrastructure and the accessibility of healthcare in smaller cities and districts. So the medical insurances have to be, upgraded, and people have to be taken care of. When a person is said to have been affected with HIV or AIDS, they are shunned, they are rejected, they are ousted from society. And what ultimately happens, there are children born because they have imbibed this HIV from their mothers who were AIDS patients. So they are rejected in orphanages and government homes and things like that. So this ouster, that denial, that fear, that stigma attached to it should be removed, and it can be only removed by creating awareness. What exactly is AIDS? AIDS is acquired immune deficiency syndrome, and it is the term given to a combination of symptoms which results from a breakdown of the immune system. It is a final stage of HIV and causes fatal infections. This is a disease in which defense system of the immune body is weakened and gives rise to a variety of symptoms, leading to various disorders and diseases. AIDS is actually is caused by a virus known as human immunodeficiency virus. That is the reason why it is known as HIV. And this virus attacks the immune system and leaves the body vulnerable to a variety of life-threatening infections and cancers. HIV is actually transmitted primarily through sexual intercourse, oral, anal, and vaginal sex, and also transmitted through vaginal fluids, semen, and breast milk. It is also transfused through blood transfusion or by use of non-sterile HIV-infected or contaminated syringes and needles, and from an infected mother to her unborn child. So what happens? So awareness has to be created. So the government should approach these places where there is congested congestion of prostitution and the sex-oriented businesses where there are people working, the sex workers, and the governmental agencies should visit them and teach them, make them aware of the side effects of unprotected sex, and they should make it a point to give them free condoms and things like that. And also there should have child programs in every school. There should have a sex education class where children are taught about the pros and cons of sex, and it should be introduced at this level, because India is a country which has a very traditional outlook, you see. So sex is a taboo, so people are not very comfortable with the word sex, and parents find it very hesitant and reluctant to even teach sex education to the children. So the best part is it has to be tutored to the children in school, and they should be made aware of what exactly is happening, how it can be protected or and prevented. The use of drug abuse, that is also another cause, because the needles from one infected person can cause HIV in many others. So these are the things. And apart from that, there is discrimination, stigmatization, and denial. DSD. These are the expected outcomes of such values affecting life in families, communities, workplaces, school, and healthcare settings. See, the moment you come out and say that I have AIDS, then the family frowns upon you, society looks down upon you. So what happens is the victim is not open to revealing his health condition. He doesn't want to reveal. Why? Because of the fear of ouster, the fear of rejection, where the family will throw out the child from the house. There are so many people who have driven away their children, so they find help and shelter in orphanages or in some work homes or in some slums, or they just get together and they have to start a new life. So this shunning away should be prevented as such, because HIV at the most is not a contagious disease. It is not like scabies where the skin touches or something and it happens. No, it is only transmitted during the sex or during this blood transfusion and things like that. And there must be appropriate policies for good practice which are not developed still. So people living with AIDS and HIV continue to be burdened with poor care and inadequate services, and those in power do little to help or make the situation better. See, individuals with HIV, AIDS they always report fear of isolation, rejection, judgmental attitudes, severing of relationships, denial of support and care. Because of such negative experiences, HIV positive people become more and more distrustful of relationships, both personal and social. Most of them, in fact, suffer from anxiety, depression, isolation. They have suicidal thoughts. They have self-harming tendencies. The fear of others effectively prevent these people from accessing help. So one should be more compassionate and more show sympathy, and they should, have counselors to treat these children. It's bad enough that they've got this dreaded disease. We don't even know how many days they are going to stay on this earth, but their life could be made better for them. And the self-imposed tendency, isolation, and this tendency to hide one's HIV status contribute to a hidden epidemic. And the most worrisome result of this hiding this disease is the silent spread of infection. Many HIV infected people, in their desire to remain undetected, have difficulty with safer sex and safe injecting drug use practices. So sex workers and third gender, gay men experience AIDS-related discrimination and stigma in ways that marginalize them not only from the mainstream, but also from their own communities. See, in fact, if we have made such exponential progress in combating HIV, why hasn't our perceptions of those with the virus have evolved, not evolved alongside. Our treatment of HIV has advanced, but why hasn't the stigma changed? HIV in the 1980s was known as a death sentence, but not any longer. In fact, the third gender, known as previously known as eunuchs, because of their discrimination and stigmatization stemmed mainly from their attitudes towards their sexuality. But now those even in the sex trade, some earn their living through begging and are also stigmatized for earning money via unnatural sex. AIDS has only added to their sense of isolation and marginalization. In fact, with a view to safeguard the rights of patients suffering from HIV and AIDS, the Ministry of Health and Family Welfare has rightly announced the enforcement of the human immunodeficiency virus HIV and the acquired immune deficiency AIDS syndrome and Control Act 9 2017. And this was done immediately after the landmark move of the Supreme Court to scrap the provisions of Section 377 of the Indian Penal Code, which previously criminalized homosexuality. The title of the judgment is Navteej Singh Johar versus Union of India, reported in 2018 10 SEC 1. And this decision has strengthened the rights of the lesbian, gay, bisexual, transgender, and queer, that is the LGBTQ community, since it comprised of a large margin of HIV and AIDS infected population in India. And this act prohibits all forms of discrimination against any person inflicted with HIV and AIDS, and also gives informed consent and confidentiality with regard to the treatment of such individuals, and places obligations upon the requisite establishment to safeguard their rights. As per the law, no person shall discriminate against the protected person on any ground. This act also states that no HIV test, medical treatment, or research can be conducted over any individual without their informed consent. And also, no person is at all obligated to disclose the fact that they suffer from HIV in order to obtain employment or any services, unless done in the informed consent of the individual, or if a court order is required for such a person to do so. This legislation also safeguards the property rights of HIV positive individuals and provides that every HIV affected person below the age of 18 years shall have all the normal requisite rights of residing within a shared household and thus enjoy the facilities of this household. So this came in 2017. The government brought about this legislation because they found that these children from the homes were being thrown out once they knew. Just imagine a child born in that house was being thrown out of the house just because he was diagnosed with AIDS or HIV. So the government brought in this legislation to safeguard and protect the property rights of these kind of victims. And the law also further prohibits all individuals from publishing any information or advocating any untoward feelings of hatred against HIV positive individuals, along with any other person who is living with such person. So even if there is a welfare home or there is some foundation which takes care of this HIV positive people, they cannot be harbored with feelings of hatred or disassociation. So even they are entitled to protection. So what is the government trying to say? The government is trying to encourage people to take care of these people, and anybody who are discriminated on this ground, action can be taken against them. In fact, the Medical Council of India also Act lays down certain duties that have to be observed by doctors who are treating patients of AIDS and HIV. And the foremost duty of the doctor is to take care and to take informed consent from the patient. There has to be disclosure of information, and the risks to the patients should be informed to the patient. So what are the risks involved and things like that. Thereafter, they also provide information of the options available and the benefits. So what are their options? Can they go for surgery? What is the thing that they have to do? What is the food they have to take? How long they are going to survive? And in the best of conditions, all these benefits, and they also give mental counseling. So, and because they are in going through trauma, apart from physical trauma, they are going through mental trauma as such. So they need to be counseled so that they don't adapt or have these suicidal tendencies or do any harm to themselves. Then there is also duty to warn the patient, saying that, listen, if you don't follow this or don't take this is what is going to happen. Yes, it's going to be fatal, but we are not going to be responsible for this. So this is also a duty of a doctor. And to admit the patient in emergency without consent. It is not as if when the patient is rushed to the hospital, he has to take the consent or signature of any of the person accompanying the patient. Like normally in accident cases or in any other case, they don't immediately admit the patient. But here they have to admit the patient once they know that he is suffering from HIV. So without consent, they have to give him immediate treatment. And the last thing about the doctor is the physician should not abandon his duty for fear of contracting the disease himself. So whether he likes it, he doesn't like it. Now doctors are gods, demigods. They serve people and they take care. So here a physician, for no rhyme or reason, even after knowing that the patient is HIV positive, should not abandon him and should continue with his treatment. Then there are provisions in the League Immoral Trafficking Prevention Act of 1986, where it provides for compulsory medical examination for detecting HIV/AIDS. It is also made for compulsory testing. Then there is also a bill, HIV and AIDS Bill of 2007, which is a joint initiative of the government and the civil society. And here in this bill, it specifically and prohibits discrimination of HIV/AIDS patients in public as well as in private spheres, like in matters of employment, education, healthcare, travel, insurance, residence, property, based on their HIV status. And the bill also provides that consent for HIV testing and research must be specific, free, and informed. It further guarantees the confidentiality of the HIV status of the person. The HIV and AIDS patients have been given a universal and free access to comprehensive treatment for HIV and AIDS. This is a wonderful initiative by the government of India, which has been brought out through a bill to give free treatment to all. And it also provides for an health ombudsman in every district to provide easy and quick access services to all persons. It also makes provisions for internal complaint mechanisms in institutions. The bill also recognizes certain rights for women, children, and persons in the care and custody of the state due to social, economic, legal, and other factors find themselves vulnerable to HIV. Custody of the states means I'm talking about women homes and prisons and mental health institutions. So even if they are there, they are entitled to this treatment, and any kind of complaint if they have, they are entitled to voice out their complaint there also. And it also recognizes the link between sexual violence and HIV and provides for counseling and treatment for sexual assault survivors. Sexual assault is what happens is when sex workers, when they provide sex, some men do not want protected sex, they want unprotected sex, so they end up manhandling the sex worker, they assault and they force themselves on these kind of women. And it is a very traumatic experience because some men are perverts and they get that sadistic pleasure of transmitting the disease to somebody else. So in these kind of cases, these kind of treatment, counseling, and is given to these survivors. Then we have the control HIV and AIDS Prevention Bill of 2010. And this also contains stringent provisions to check discrimination against HIV and AIDS patients. See, according to this bill, testing for AIDS is a prerequisite for employment or for access to healthcare, education, or public places. They can move courts against discrimination. Moreover, the bill proposes that any person, who has denied employment except with the written assessment of a qualified and an independent healthcare provider, that the afflicted person needs indeed poses risks of transmission. So the bill here makes a safeguard provision against eviction for people below 18 years of age and a woman of any age. See, a child is entitled to stay at his place if he's below 18, but once he's 18, he's been asked to go out. So that way they make provision. But for a woman of any age, doesn't matter. She's entitled to stay there and live in a shared property. And the bill also ensures that no person can be forced to take an HIV test. It is informed consent of that person concerned is a must for conducting test. So it is not compulsory that somebody can force a test on somebody. No, they have to be informed. They have to take the consent of that person and then perform the test. And he cannot be compelled to disclose his HIV status except under directions of the court, or a doctor can disclose the patient's HIV status to his partner if he believes there is a risk of infection. Now, what is the right of a HIV patient? A right to treatment, that is the predominant right, which is given to him. So a person suffering from this ailment has the right to get treatment for his suffering. Treatment cannot be denied to a patient on the basis of his HIV or AIDS status. It amounts to discrimination. Supreme Court has issued directions to make second line HIV and AIDS victims treatment available free of cost to all those who need it. And then the other right is confidentiality. A person who has been diagnosed with HIV and AIDS has the right to keep the status confidential. So what is the right to employment and right against discrimination at workplace? Right against discrimination is a fundamental right which is possessed by a citizen of India. No one can be discriminated on the basis. They say that no one can be discriminated on the basis of caste, age, creed, religion, and things like that. But here, no one can be even discriminated on the basis of HIV/AIDS status in India, because HIV and AIDS patients have a right of equal treatment everywhere, and they cannot be denied job opportunity or discriminated in employment matters on account of their status of HIV. And the Supreme Court has also advocated in the favor of better living for sex workers. It has also directed that the central and state governments should prepare schemes for rehabilitation of physically and sexually abused women. So I have a few suggestions to make, That is, one is to enact an anti-discrimination legislation that should apply equally to both the public and private sectors and should prohibit work-related discrimination. The legislation should also include prohibition of pre-employment HIV testing, routine health checkups with mandatory HIV testing, reasonable accommodation. I say so because once the employer comes to know that this person is afflicted with HIV or infected with AIDS, then immediately they start singling him out. They don't mix in the group. So it leads to kind of a mental stress and a kind of rejection for that person. So he is not accepted in society, you see. So the stigma remains. So what is the use of giving him employment, but when he is being ousted or singled out and pushed out? So that is not a good solution, because we don't even know how many days he has on this earth. So why should he be made to suffer, especially when medical facilities have become much better than what it was 40 years ago. The conditions, the living conditions have improved. So, it's not that fatal to him any longer. And when it is, there are cases where it is even undetectable or untraceable also. So he should not be tortured like this, or this discrimination plays havoc with the mind. So this should be prevented. So, and then another thing is to increase private sector and community participation in response to HIV/AIDS, and including building capacity and responsibility of civil society to respond ethically and effectively. The government has done much towards prevention by spreading awareness about HIV and AIDS, but it has not done much to those who are already suffering from it. The government should introduce some positive discrimination in the form of insurance and healthcare benefits, and introduce medical insurance schemes to cover HIV positive employees. In fact, here I would even suggest that the government not only covers them medically, as insurance for them, but even people taking care of them, even if they are given some kind of an incentive or financial assistance, then life becomes much better, because ultimately they are not only giving social service to the victim, but they are also being looked after by the government physically, personally, and financially. Then there is this NACO. It is a national AIDS control organization. It is a nodal organization for national AIDS, and this is in response in the Ministry of Health and Family Welfare. It is funded by the central sector scheme, implemented through the state and union territory AIDS control societies, and monitored through the district AIDS prevention and control unit in 188 priority districts. So it is under implementation from 2017 to 20. What is the components of NACO is? It's targeted intervention for high risk groups, that is female sex worker group, men who have sex with men, injecting drug users, bridge populations, that the migrant and truckers, is fundamental to AIDS response and aims to keep the population of human immunodeficiency virus free through awareness generation, safe behavior promotion, and HIV testing. Interventions for HIV prevention are also important for inmates of prisons and closed settings. People who have this sexually transmitted infections have higher risk of infections, and hence this national AIDS control program, it provides for quality standardized services at designated clinics, and these clinics are called Suraksha clinics, where there is safe blood free of HIV, malaria, syphilis, hepatitis B, hepatitis C, and is ensured through a NACO supported network of blood transfusion services. Then there is awareness generation services, which were rolled out 25 years ago with a focus on HIV and AIDS, and the services available for testing and treatment. And it still continues through my vibrant multimedia approach comprising of mass media, mid-media, on-ground mobilization, interpersonal communication across the country. And it also provides for free counseling and testing services for early detection of HIV infections. So free counseling and testing of pregnant women are also provided at these facilities towards prevention of parent to child transmission of HIV. I remember I told you that it is transmitted from a mother to an unborn child. So these are the things. And the treatment services offer free antiretroviral treatment as well as comprehensive management of HIV infected people with respect to treatment and prevention of opportunistic infections. Test and treat policy has been adopted to enhance the uptake of treatment services. And the importance of bringing this HIV/AIDS policies and programs in line with international human rights law is generally acknowledged, but unfortunately it's not carried out in reality. Policymakers, program managers, service providers must also become more comfortable using human rights norms and standards to guide and limit the actions taken by or on behalf of the governments. So to control the HIV/AIDS pandemic and mitigate its impact, it requires legal action not only within a country's own borders, but also in the line of the international human rights obligations through its engagement in international assistance and cooperation. Sustained commitment is critical to the future of HIV and AIDS epidemics throughout the world. However, no policy or laws can combat this HIV and AIDS related discrimination. The fear and prejudice that lies at the core of the HIV AIDS discrimination needs to be tackled at community levels. So I also wanted to add this phrase, we all heard this phrase, to see the forest through the trees. So I implore all of you to see the human through the disease. It's very easy to see numbers and statistics and perceived dangers. It is much harder thing to see the faces behind these numbers. So please learn to be compassionate, learn to be human, learn when you think son, think mother, think father, think brother, think human, and educate and create legal awareness among these people. So all they need is sympathy and compassion and general awareness. Educate them. Ignorance is bliss, they say, but in these kind of matters, ignorance is no bliss. So prevention is always better than cure, and it is only through sensitization programs and strengthening of sex education in schools and colleges for all teenagers. It is very necessary that one should sensitize them, make them aware. The curriculum should not only include sex education and life skills such as empathy for sick persons, and not harbor tabooed discriminatory attitudes which may be all pervasive in the atmosphere where a child may be growing up. Special laws like HIV AIDS Act 2017, which aim to correct old and archaic systems of discrimination, should be used more robustly, in as much firstly enforce the object of the act, not just at the level of authorities of the state, but private players like market holding oligarchies, which can play a positive role in stopping discrimination and crafting the ethic of the organization. And it has to be designed in a way to insensitize people in more than a way. And the courts also can play a positive role by just upholding the trust reposed in them by the legislature, giving the highest importance to the privacy and medical status of a HIV affected individual. It could actually also issue or lay down guidelines and make a system for protocol for companies to follow if there is no concrete rules or form of rules about the norms of privacy that a private organization should follow. So, and then the National AIDS Control Organization is also a step forward for spreading information and latest developments medically in the treatment, and provides for free counseling, treatment centers, healthcare centers, and continues. So this is all about AIDS, its rights, its impact, and how we can change society by looking at, by having a more holistic approach towards it, changing the mindsets and changing the mindset of the generation of these years. So, Professor, I also urge you to have a lecture on sex education and,
Yes, ma'am. Yes, ma'am. Yes, ma'am.
do that. Yeah.
Surely, ma'am,
Thank
we will do next time. We will do this, ma'am. There is no issue.
Yes.
And ma'am, first
Yes.
of all, I am very much thankful that you have gone through the whole detail on this topic. You have elaborated that Johar case. That was very fantastic case. I think Karan Singh Johar, na? I think.
And Navtej Singh Johar
Now
reported
saying
in 2008,
actually,
18,
I've
10
just written by mistake.
Yeah, that
So, and secondly,
decriminalized.
yeah, and secondly, you have elaborated the rights of the person who has with the AIDS, and what are the due, and what the government is doing, what is the legislation, what what you have suggested, the various part that the
In
legislation
fact,
should
I'm
think
glad
about.
that the government has woken up and they've brought in new laws and rules,
Yes.
especially post-COVID, and I'm glad about that. And
Yes.
Pallavi, I missed you at the introduction. A very good afternoon to you.
Good
I wish
afternoon to
all-
you, ma'am. I'm so sorry that I was actually
No,
stuck in
no.
the traffic and it took me some time to reach home.
No
But
worries.
it was so insightful. I believe that, I actually have nothing more to say because you've covered the entire gamut of all the laws, all the rights, everything has been covered. So I doubt that I
No, but
actually
I
will have too
still
much
would
to
love to
contribute.
hear you. I would still love to hear you.
Yeah, ma'am.
No, my pleasure, ma'am.
Thank you so much. Thank you so much.
So thank you, ma'am. Thank you, Mahalakshmi Pavani, ma'am. You have spared a very valuable time to us, and I can understand that you are one of the toppest advocate at the Supreme Court, and still you have spared the time to our university. It is a great pleasure to my students. Now I am handing this session to one of the good advocate and advocate on record, Pallavi Pratap ma'am. And whenever ma'am I have any topic, madam never says to me. And whenever I need that, yes, I want that this would be teased. So I just call and she immediately accepts. So this is my pleasure, and it's a great pleasure to Pallavi Pratap ma'am. So now, ma'am, I'm handing this session to you so that we can listen you, and we will then we have in 5 to 10 minutes. Last 10 minutes, we have some questions session to both of you, ma'am. Now the session is handing to you, ma'am.
Thank you so
Over
much,
to you.
Dr. Rajesh. I'm actually, because ma'am has covered everything in such an amazing fashion that I really don't think that there's so much to contribute in terms of the legal part of it. Although I actually wanted to share some of the experience that I had. So before becoming an advocate, I was actually in MBA finance and I was working as an investment banker. So there was a time in my career where I was looking at micro insurance schemes. So what is a micro insurance scheme? A micro insurance scheme is something where people pool in money so that there is a form of a health insurance which is provided to anyone and everyone who has pooled in, because this I'm talking about is some 10-12 years back, and this was 2008 2009, when health insurance was also not so penetrative as far as India was concerned. The elites had health insurance, and all the the BPL section, or specific people who would have specific ailments like HIV patients, they were not covered under it. Even now, I think as far as health insurance for HIV/AIDS patients is concerned, it is only one, I think, Star General, which provides any form of health insurance to them. And most of the other health insurance companies actually do not cover HIV/AIDS patients. So this was a time when I was doing this micro insurance policies, and there is an NGO which is called as Plan International, and I was working very closely with them at that point in time. And they had identified these areas where, especially around in Kerala and Karnataka, where they had identified that there were villages where the incidence of HIV affected people was more as compared to the rest of the state. And this was primarily, like ma'am said, about because of the truckers. These used to be heavy national highways, and these were villages which were situated on the boundaries of the national highway, and therefore there was the incidence was huge. And these were women. And children who were mostly affected by HIV/AIDS. And there was no health insurance scheme which was provided either by the government, the state government, or the central government. And there was no such policy which could actually cover. Now, as we've discussed, and ma'am has taken us so well through even how HIV is caused and what kind of medicines are required. Like, for instance, ART, which ma'am just covered, antiretroviral therapy. Now, ART is primarily a therapy which keeps going on for a long period of time. But how do you counter HIV or AIDS? It's not like, for instance, a tuberculosis that has happened and you are taking TB medicine for an X number of months, and then this sort of goes away. No, these are incidences which happen. So for instance, an HIV patient might have fever, and that fever will be elongated. So somebody like you and I, who are in the healthy category, might recover from a fever or a viral fever in, let's say, 5 to 7 days. They might take as much as 20 to 25 days. Now, when they are taking that much time to recover, A, their livelihood is gone. B, they don't. They basically are from that segment of the society where they cannot afford to pay the doctors or get the medicines. So they sort of, if they are on the brink of BPL, they might just fall below poverty line then. So so this was something that was identified by at that point in time. The Ministry of Labor and Employment had identified this issue, that there was no micro insurance policies, or rather health insurance policies, which was available for the HIV/AIDS patients. So we tried to, with Plan International, we tried to work on a specific project where we decided that because it was difficult to, provide them with a health insurance coverage, we would look at a pool which would be made where everybody, just as a lot of you would be aware that we have something which is called as a third party insurance for our vehicle, right? So this third party insurance typically is something which goes into a pool, and if there is any incidents that takes place as far as our vehicle is concerned, so there is a third party insurance which is provided and you can always claim under that. Similarly, we thought that why can't we just replicate a model like that for these people who are, on the outskirts of the society, in that sense, being HIV and AIDS positive. And so we built up a pool for them, because we realized that it is, even though the incidence is there with HIV AIDS patients, so they might get fever, or they might have stomach problems, stomach infection. So because their immunity is low, the infection occurrence is huge. It happens and it stays for a longer period of time. So if there is a pool of money which is provided, people can take out money and get their treatment done. This I'm talking about is about 12 years back. Now, of course, like ma'am said, there are such amazing plans which are going on just now as far as healthcare is concerned, as far as the kind of treatment is concerned. I think amazing effort is there from the government's end itself. So we see now that it is easier for an HIV/AIDS patient to have access to healthcare, but about 12-13 years back, it was not so much. So that's how we started, and it was the first, one of the first kinds that we saw. This was a model that we had replicated from South Africa, because a lot of you would know that Africa is where obviously the HIV/AIDS is one of the most prevalent. As a matter of fact, I was reading an article just yesterday in New York Times where there was an entire discussion on why is it that they say that South Africa actually has all the infections that come first in their country. So in defense, there was this doctor from South Africa who said that because of HIV/AIDS, so many decades back, we have invested so much into the infection monitoring aspect of it, that now any infection that comes in the world, we are the ones who actually have the latest research. We are the ones who first identify. So by the time now the world is rising up to Omicron, they already knew about it. They already, I think, you would want to unmute ma'am, because I think she wants to contribute and she's unable to. Rajesh sir, would you unmute ma'am, please?
Yes.
Because ma'am was saying something.
Yes.
I'm sorry, I couldn't.
No.
I just wanted to interrupt you. Sorry, when you said everything emanates from South Africa. In fact, the first Omicron virus, the latest variant of COVID, has been detected from Botswana. So
right, ma'am. So yeah, so they were saying, this is what they said, that it is not that it is emanating from South Africa. It is just that we have that technology that we are able to identify immediately and see the mutation. So for instance, I mean, I'm not saying that our country or an XYZ country doesn't have that kind of a thing. It's just that they because of HIV/AIDS, and he explained this, that because of HIV/AIDS and all the different infection that was coming as a result of HIV, they had this whole the technology and the infrastructure is so improved over there, which is 100 times better than anywhere else in the country. So it was from that point in. But you're right about Botswana. It's actually true. It's actually started from Botswana, and that's why I think every other country is now stopping flights from at least that general area.
Yeah.
Yes, ma'am.
No, they've banned flights from the US, also Europe and Africa. Africa first.
First, yes, ma'am. Japan, I saw today. My brother was showing me that the Japan International Airport at Tokyo completely empty. There were only 2 cops who were roaming around the entire airport. And I was thinking, see, this is how one has to be proactive, because one doesn't know. I think Dr. Guleria was saying that this virus, which is coming, Omicron, is about 100 times more infectious. So I think
the vaccines don't protect, and the vaccines don't protect. The vaccines which you and I have taken are not going to shield us from this Omicron.
That's right, ma'am. As a matter of fact, I remember a couple of months back when we had Dr. Guleria in that SCBA function, you had just recovered from COVID and you were literally very weak, I think I remember, because you were saying that, it's taken me, it's a shock to my system that, the weakness and the kind of problems that one faces because of that. So yes, I think we will require those boosters. I'm drifted from the topic. I'm so sorry about that. But yeah, so my point was just this, that, HIV/AIDS, if you look at it, these are infections. And as with COVID and all going on, their exposure becomes more. So this was how health insurance at least was started. But we saw that there was a discrimination which was there. And right, just as ma'am pointed out completely rightly, that these discriminations, and she's done a fabulous job as far as Navtej Johar case is concerned. I mean, 377 for I think it's been an extremely welcoming judgment in that sense, and for people to identify that their rights, their privacy. That's, I think, privacy, like ma'am said, is the most important part for anyone. I mean, just as you have it, there was a movie also, ma'am, which had come many years back. I don't know if you remember it or not. I was still in college, which had come only on AIDS, and it was one of those out of the league kind of a movie which had come in India. It was a Bollywood movie, and they had actually Mitra or something, I don't remember, and they had actually shown the entire journey of an AIDS patient and the kind of discrimination that he had to face at that point in time. And this I'm talking about is, I think, about 15 years back. So 377 was something that was not, people were not so open about it also. So now, of course, you have friends who are openly gay or who are openly lesbian, or they actually feel that, and they proudly talk to you about it also, and you also don't feel any discomfort. But at that point in time, nobody knew also that there was something like this which existed. So the acceptance level was much low. And there was this movie of Uma Thurman, if I'm not mistaken, which was a Hollywood movie, where again, her journey as an HIV/AIDS patient, she had a child who was thankfully not HIV/AIDS positive, because quite a lot of times it happens that maybe the child might not have, might not be positive. So those journeys actually show you the discrimination. And I'm sure, like ma'am said, even now that discrimination exists. I think discrimination for all of us in all aspects of lives actually exist at certain levels. And for people who are from these special categories, so to say, the discrimination is much more. So I think, like ma'am said, NACO is doing a fabulous job, National AIDS Control Organization. I think the kind of plans that they have, and of course the incidence of AIDS is now reduced. I remember reading many years back when I was doing this research for AIDS in the microinsurance sector, that in the early 1980s, the then Prime Minister, Mrs. Gandhi, had said that, AIDS type bimari hamare country mein nahi hoti hai. She said it because she thought that, this is something that will not happen. And then, because it was actually the early 1980s that the first case was identified. So we obviously thought that because we have a certain culture that comes in, this kind of incidents would not happen. But with the years, I think by 1986, 87, the spread started to be seen. And we saw that in the 90s, because of the truckers and all, liberalization happened, and there was a lot of economy which opened up. So because of the truckers, the 1990s and the early 2000s, we see that there was the graph was going up. Now, of course, with the government having so many preventive, schemes which are going on, we've seen that the graph actually coming down. So I think I've taken too much of everybody's time. If there are questions, ma'am and I will be happy to answer. I'm sure ma'am also has to go.
Yeah, in fact, Pallavi, I want to tell you here. So Indians, we are traditional in our outlook, and our mindsets are very, myopic thing. But
Yes,
what about America? America also had this kind of stigmatization towards its patients. It was the case of, I think it was in Ryan White's case in
Yes,
1985. A 13-year-old boy was detected, a hemophilic boy. Yes, he was, diagnosed with hemophilia, but they said it was actually HIV. No, it was through blood transfusion he got it. So then their perceptions changed. So that is what I asked, when medically we have been doing so well and things like that, why hasn't our perception towards these HIV positive virus people not changed? So That's
Ma'am,
it.
even if you would remember in the first phase of the lockdown, or even up until I think before the second phase of the lockdown, people were discriminating even COVID patients. I mean, that discrimination was there. Oh, you've had COVID,
Yes,
so people would just discriminate, or you had those parchas which was put on outside their house, and people nobody would supply milk or give
true, true, true. In fact,
vegetables
even
with
now,
curd.
Dr.
So many
Vinod
cases like
Sharma
that.
of
I
National,
think
yeah, in a National Heart Institution, Dr. Vinod Sharma, he told me, he said, Mahalakshmi, can you believe it? People from the richer, affluent backgrounds did not take their bodies of their dead parents home for
correct.
the fear of contracting. So when I said, think, when you see a patient, think brother, father, son, but I don't, and think human, but I don't think it's going to have any effect on people with these kind preconceived notions who
True,
shun
true,
away. So,
true, ma'am.
that even mindset, it has to change. It's going to be really difficult because somewhere in the corner of our minds, we are closeted and clouded, that, oh my God, I don't want to die. So,
You're right about
yes,
that, ma'am. Totally. I think yes, we have that fear of the unknown, which sort of
yes,
stops us from doing things. As a matter
sending
of fact,
help.
yes, ma'am. Absolutely, that's so true. Dr. Rajesh, if we have
Yes,
questions,
ma'am. I am always there. So I am listening to you all, you both speakers. Ma'am, it was very fantastic by both of you, and Pallavi madam has also added good things. Madam, we have certain good questions from my LLM students. One, Madhu Deepa Rani, who is one of the student, and she has done LLB from this Patna, which NLU, which NLU? Chanakya on NLU, and she is my student right now. She is writing that what are the healthcare measures available in India for marginalize the community? Means how it can be reduced. We have certain healthcare, so how it can be reduced in a so drastic way? Because in our country, with the provisions is very slow. So how it can be fast, ma'am? Yes, ma'am. Over to you, Lakshmi ma'am, Mahalakshmi ma'am.
See, first and foremost, she cannot expect a drastic coming down of cases. See, drastic coming down of cases will happen only once the victims come out and in the open and say that we are affected with HIV and AIDS. And this treatment is over a period of time. It does not go away. Like as Pallavi rightly said, that we healthy people contract flu or fever, it goes away in 2 days, but for them it is an over a duration of 10 days, it stretches. So their immunity is very, very, very weak. So, and then the government has come out with this NACO, which has been started in 2017, and it's doing really well. So, and government hospitals, the Supreme Court has also mandated them to give free service, so free medical treatment. So it is a joint thing of the government as well as the medical authorities as well as the victims to work together in tandem and unison to bring it down drastically, and all of us to have that negativity away from our minds and have a positive approach towards these marginalized sections.
Yeah, ma'am. Thank you, ma'am. Well explained, ma'am. We have another question from one of the student. This is question to Pallavi Pratap, ma'am. Why does the stigma and discrimination exist, and how it can be combated as a member of the society?
yeah, I think the stigma, like ma'am also said while she was speaking, she said it's all about sensitization. And I think that is the only way of moving forward. Till such time that there is no sensitization which is brought about, there is certain need of capacity building. Because, like with all the stigmas that we've seen for centuries, they still exist, even though the number of people who might be practicing those stigma may have reduced considerably. So it's not that we have a magic wand and it will just go away like that, okay, the stigma is gone. It's going to take a lot of time. It's going to take a lot of people like you and me who are educated, who understand that there is no such thing as the transmission happening by touch, or by taking care of someone. There are ways, and uh, you know um, there are ways of making sure that the transmission doesn't happen. If you are able to take care with those precautions, I think that exposure that one has to HIV/AIDS will be reduced. But like ma'am said, sensitization is extremely important, be it
Yes, ma'am.
with the disease or anything else. Yeah.
Madam, one more question from one of the student. This question to Mahalakshmi ma'am. Ma'am, she's writing that many countries have shown the interest in ending the law criminalizing for HIV patient. Do you think that if such laws are repealed in the courts of justice, the discrimination cases may decrease or come to an end?
Yeah, that's what this higher in the Supreme Court has done. They have decriminalized this homosexuality. So with the decriminalization of that, people are now seeming to accept that LGBTC, because ultimately this is the law of the land declared under Article 142. So whether you like it, you don't like it, whether you're traditional, you're modern, whatever it is, you have to accept it. You have to move with changing times. So change is evolving. It is not, I mean, it's always.
Yes, ma'am. Ma'am, my question now. Now my question. Ma'am, as you are the head of the women's cell at Supreme Court, madam, what do you think that what legislature should have a immediate impact, or what the law can be changed so that these the person who is affected, they will get the relief immediately? So as you are the leader in the Supreme Court, so what you take care, ma'am, in the Supreme Court? This is my question, ma'am.
See, doctor, there are already enough and more laws. We don't need any more laws. We only
Okay.
need that these laws to be implemented to the T, to the point. So discrimination, yes, you should move the court and seek discrimination and have the man punished, whether it's an orphanage, whether it's a government home, wherever. And people, even in the houses, when the parents do not give they throw the children away or they excommunicate them, and if the child is less than 18 years, he has a right. And even women, if there are sexual assault survivors, so if the survivors go to court and take the man to court, I think then the change mindset will change and things will happen. There are enough and more laws to combat with this, but implementation and also ensuring that you take the law, you take help of the law to get justice to yourself and punishment to those accused people.
Yes, ma'am. Ma'am, last question. One of the students, Sriyan Shukla, has written on the chat box itself. Do you personally believe that WHO and similar entities have done a great job in fighting against the HIV? Mahalakshmi, ma'am.
Yeah, they have in fact, they have taken the lead, and they have in counseling and bringing about treatment, HIV treatment, protection centers, counseling, healthcare. They have done a lot of things. They have targeted appropriate technical and groups, and they have got technical and financial assistance from all kinds of corporates, and they are they're monitoring the progress also. So they have actually this World Health Organization, it also has this what do you say, it helps important it helps countries in prevention, care, treatment and support programs. So it is not as if, see, the World Health Organization is doing it for the world at large. So we have NACO, then we have this Immoral Sex Traffic Act, then we have the HIV Act of 2010, we have all these acts which the government itself is implementing, especially after the COVID-19. The government has definitely woken up to the medical health facilities of the people of this country, especially the poor people. It is between the haves and the have-nots. So there are macro policies and medical healthcare insurance that are being provided. So that it just give them some time and they will work, because they have all been hurt and they've all learned through this disastrous pandemic.
One last question. One student also written in the chat box to Pallavi ma'am. How can we improve the living standard of the sex workers when sex trade in India is illegal and they fear getting identified in the ideas of the law? So how can the government do that? Have they identified some areas in the bill to ensure the immunity?
See, I think this question is in two parts. I'll just tackle the first part, which is about sex trade being illegal. Now, we all know that sex trade is illegal, but I'm sure we are all aware. We all know where the red light district is in a particular city, right? It's not that we don't know. So if we know it, then I'm sure the government also knows it. As a matter of fact, there was this movie which was made by Lucy Liu, which was on human trafficking, which was made by Apne Aap. There is an organization which works only for women and into human trafficking of women and children. And they had shown it very vividly how human trafficking happens, and these little girls are picked up from villages, etc., and then put into sex working. Now they become sex workers, but like somebody had asked before, WHO, etc., doing a fabulous job or not, like ma'am also said, UNICEF, WHO, UNDP specifically has these programs which they have identified, and which are most importantly in the red light district areas, where they provide them free condoms, they provide sensitization, they inform them that if there are XYZ things that are happening to you, it is important that you see a doctor. They also do rapid, HIV tests for them, so that they can identify if at all, let's say, out of a pool of 100 women who are volunteering to get their HIV tests done, how many of them are impacted by HIV, who are HIV positive or maybe have AIDS, so to say, or other STDs, because it is not just one disease which could be there. There can be other STDs also. Now, so it's not that the government doesn't know. It's not that the government is not aware of it. And the government has these programs also, which are all working. I think the state governments have it, and also the central government definitely is sponsoring quite a few. You don't see them now, but about a couple of years back, if you would be traveling down, let's say from Delhi to Lucknow on the highways, you would see there were too many of these narco boards which were there with the AIDS thing and the condoms to be used, and these messages which were being provided just so that truckers and people would know that there is something which is called as AIDS, which can be fatal to you, and that it is preventive, so you can prevent yourself. So as far as anonymity is concerned, as it is, if you would see, sex worker as a profession is not identified. So they are anonymous in that sense. They might have an Aadhaar card, but they would not be considered as a professional. Like, for instance, if you would see in Europe, in many countries, this is legal. It is legalized, and that Amsterdam, for instance, you would see that they have to have their tests done. They have specific, requirements in terms of if at all there is a sex worker who's indulging into any sexual activity of whichever kind, they are required to follow the protocol which is there. Right. So unfortunately, in India, of course, because we've not legalized it, it is still a gray area, and there is no monitoring, so to say. So we are still touching this problem with 100 feet long danda and trying to figure out how we are going to fix this problem. I think legalizing, like ma'am also said, that maybe that could be a step one, just as 377 became one of the steps in order to curtail. So now I am not worried if let's say I am someone who likes men. I'm a man who likes men. I might not go to a doctor because I was worried that my privacy is done away with. There was a series which had come, Made in Heaven or something, where they had shown this, that how that boy was traumatized because of the fact that he was gay. Now, of course, I can go and I can speak and I can, have my rights claimed. Similarly, if we have some kind of a legalization which is done for the sex workers, I'm sure, the mitigation would be there in terms of disease prevention and mitigation. I hope that answers the question. Ma'am has to add something. Yeah.
Yeah, I just want to say this.
Yes,
See,
yes, ma'am. Yes, ma'am. Yes, ma'am.
Sex workers are also human beings, doctor,
Yes.
and they are also entitled to a
Yes.
life of dignity. There is
Exactly
an
correct.
urgent need to accept and recognize their existence and ensure that their fundamental right to life and the right to live with
Yes.
dignity is protected as promised under the Constitution of India. So there is a need to adapt a legal mechanism to regulate the service conditions. In
Yes, ma'am.
Buddhadev Bhattacharya versus State of West Bengal 2011 SCC 538, the Supreme Court said, yes, they are sex workers, are human beings, but no dignity can be accorded to sex workers till they remain lurking on the wrong side of law as criminals or outlaws, as accused. So the best thing is, in my opinion, as well as I'm sure Pallavi will agree with me, to
Yes.
legalize sex. So this
Yes.
prostitution, these brothels, it has to, they have to, these red light areas, they have to legalize them, and also make them, give them sensitizing them, and giving them lectures and training, and highlighting the pros and cons of unprotected sex and things like that.
True, ma'am. True.
So, ma'am, it is a really good answer by both of you, and you have spared a valuable time to us for our university. We are very much thankful to you. And there is some meeting with ma'am. Dr. Devati madam has exited because some meeting with the president sir is there. So, on her behalf, and on Dr. Akhil Syed sir behalf, and from the Parul Institute of Law, I am thankful to both of you for giving this precious time to us, and a very fantastic and means interactive session. This is really a wonderful session, ma'am. So I'm thankful
Thank
to
you,
both of you.
Doctor. Thank you,
ma'am.
students,
Thank
and
you.
thank you, Pallavi, for being very cooperative with me.
Thank you so
much.
much, ma'am. It was such an honor to hear you, and thank you,
It was
Dr.
a
Singh, for
pleasure
inviting us.
interacting with you. Thank you, Doctor. Thank you.
Okay, ma'am. Okay, thank you, ma'am. Thank you. Thanks a lot. So, Jiten sir, we are closing this session. Jiten Kovani sir. Jiten sir. Jiten sir, are you there? Jiten sir, we are closing.